Can you see? Okay. Okay, this one, the being is in size. It's bigger than the bird's peak. It's a little bit larger. We have a 那个等一下有那个 bump 吗？有没有 bump? Okay. This bean pulse is a little bit shorter than the width of your finger, finger's width. Okay, and this can be anywhere. This can be anywhere between 寸 or between 寸 guan or 寸 or guan or between guan and 尺 or even beyond the 尺. Sometimes it's difficult to explain. I'm still trying to find out what's the matter with it when this bean pulse appear away from the 尺. Anyway, this one can have a very interesting case that tells you that everything is swollen inside. Depends how the jump of the stuff. I have a very interesting case on Friday. I have 4 patients consecutively in my office. They all have the same pulse here, like this. It's shorter than the width of my third finger.
What side?
What side?
Yeah, left or right?
One is both. One is on the, most of them, 3 of them on left. And something like this. Like this, like the tip under my finger. Okay, there are 4 people. First is the lady. Like I told him, I use a red crayon to draw the drawing, and I like to use crayon. Okay, it's very effective. And I said, "Hey, you have something swollen down there." And after I said that, she showed me her toe, the toes. Only one toe is actually all the toes, the big toes, swollen up, just like a red crayon stuff, swollen up, full of water, like a balloon. That's exactly the resemblance of the pulse and her condition. But the second young guy with both hands with this, he had bladder cancer, which I think is more than that. But anyway, he had blood cancer with bladder cancer. I'm sorry, bladder cancer with the blood in the urine, and I checked his ear signs. Do you have an ear? It's very interesting. This area is the genital and the urinary tract infection, bladder. Actually, it's the pelvic. His ear, one ear, the left one, this area is red. The right ear, this area is brown. It's dark. So I say there's a blood there's an inflammation there and dead blood in there. Then he showed me color photos of the scopic some stuff. Yeah, I can see the color picture of her inside of his bladder. One part is dark, one part is red. Just exactly this resemblance of his ear signs and the pulse, and it's all swollen. And the third one is a lady again with the pulse she had a swollen ankle. Yeah.
I'm sorry.
No problem.
The last guy, was the bump was the bean pulse on the right side or the left side?
No, that guy has both sides. So I told him it's a little bit more than the bladder. I think something wrong with the genital area too. Huh?
Sure.
Yeah.
His prostate area?
Yeah, something. But I don't want to scare him. He's already so frightened. Anyway. And the third lady was just swollen ankle with the same pulse. Bang, 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 bang. Pounding, expanding. So that's resemblance too. Her feet, her ankle is swollen, and not the toe, but the ankle swollen and inflamed, all red. So this is time we can use some astringent to deal with it. And the fourth guy was the prostate. Yeah, he had both hands with this pulse. This prostate swollen. So all the pulse, this is not a complete pulse sign, right? So this is just the shape. But the jump, if the jump is strong and expanding, that means there's a lot of inflammation there. We use something to shrink it back and to clear the fire. Then that will treat the problem.
Jimmy?
Yeah.
Were all those beans above the middle? Or below the middle?
Depends on the condition. Depends
But I
on.
mean, in these 4 cases,
Uh-huh.
were they a little bit above the middle?
No. It's kind of in the middle and low.
Middle and low?
Damp, because they have water in there. You can clearly see her toes. You push down, it turns white. There's a lot of water in there. So the pulse is deep. So we use water clearing medicine. We use astringent and fire clearing stuff to treat that. Yeah.
If the beam pulse looks just like that, a little bit above the middle,
Uh-huh.
on the chirp position, what do you think when you see that? Because normally those beam pulses are below the middle.
Yeah, it's possible.
What if it's a little bit above? What would you think?
Nothing, just same thing, just fire.
Not so much dampness?
Yeah, not much dampness, more dryness. But mostly, this means something down there inflamed.
If it's a woman and it's above the middle, then sort of what would you think is there?
There's something swollen there.
Just swollen.
I don't know where, but it doesn't matter. No matter where, we use the same treatment plan.
Yeah, that's the good thing.
Yeah.
The treatment plan's the same.
Yeah.
Even if you're a little bit off.
Yeah. No matter it's in the knee joints, no matter it's in the ankle, no matter it's in the testicles, no matter it's in the prostate, we treat the same with the same combination, same method, same approach. Yeah, you're right. Some of them, those big guys, this pulse can be so deep, but still they're swollen, hard. Then we have used some breakers. It's all listed in today's stuff. We destroy that, we eliminate that, we shrink it, we get rid of fire, get rid of the water. We don't care the name of his problem. We don't care what his medical doctor told him. We don't care about the term. We don't care about the name. We only care about the nature of the problem. The name is not important. Okay, this pulse can be anywhere. I'm just giving you an example I saw on Friday. It was so interesting. 4 people came in just continuously showing this kind of pulse with different kind of problems. So if it's harder, it's worse. Any questions? Okay. What else?
The herbs we listed are general guidelines as to what you need to use, what kind of herbs. You need to use the herbs that break up the stagnation and the swelling, and also use the astringent combination to shrink it up because of the swelling. But there's no specific one formula for all, short beam pulses, because it depends on where it appears. The herbs will be a little different because the herbs enter different channels and different locations. So for specific prescriptions, we'll talk about that in part 3 of the Pulsynergy. But in general, if you find this kind of pulse, you need to use these type of herbs, the breakers. Okay?
Okay, this one. Okay, short. It's a little bit bigger than the bean, and a lot bigger than the bird's beak, than the pen tips. Okay, the short pulse is Yangming. Yangming has to be floating. That's from my 6-qi pulse system. I didn't invent it. I borrowed it from the Huangdi Neijing, which I suggest you study a little bit. It's very, very interesting book. Even it's been so many thousands of years, it still gives us a very good information, a lot of good information. So, there's the Yangming. So we have 2 Yangming, right? It's the name of the channels. We all understand that, the stomach and then the large intestine. So Yangming got something to do with them. And also, remember, Yangming means surface. So, if we have this pulse on the right cun, not only the respiratory system, but also there's got to be some skin problems. And the Yangming was floating, always floating. That's the definition for Yangming. So floating, the pulse, which means you can feel the pulse jumps when you touch the surface gently. And usually it's quite strong. That means a lot of dryness there. That's very important. We have six qi, right? The wind, the coldness, the dryness, the heat, the summer, whatever. And the Yangming, this pulse like this. Usually we don't have 3 of them at a time. Just this one. That means dryness in the upper respiratory system. That means allergy. That means skin problem. That means the large intestine also dry. That means the conclusion is dry. So don't use any dry medicine for him, no matter what the complaint is. So instead, on the contrary, what kind of herb we should give it to this guy, no matter what the complaints may be? No, I have to moisten it, dryness. Moisturize, yeah. Salty too, for the fire, but we have to moisturize the yin, 石膏, and 甘露饮 or 麦门冬汤, something like that. So this pulse always, short pulse always supposed to be floating and forceful. That means dry heat. Okay, like the engines out of lubrication, it's too dry, so temperature rise up. And that always gives a problem with the large intestine, the lung, the respiratory system, and skin. So if it's become hard, it can be tumor or cancer. Yeah. Usually it doesn't happen 3 of them at a time. So this graph is not a complete design, right? It's just the shape. We don't know the jump yet because it's not saying here. So if the jump is hard and fast or strong, that means what? That means what? Heat. The more heat, then the stagnation. And the stagnation can be the result of the excessive heat because it's all swollen inside. So we use something cooler for that, to shrink it, or to use something astringent to shrink it back. So the herb, I designed the 2 of them. Oh, it's very interesting, Cold breaker and hot breaker. Cold breaker is 三汪不流行. This for cold means for the cold condition. Okay, if it's no excessive fire, just simple blockage, like the lady, her period hasn't come for 3 months. It's all stuck inside. How do you know the lady has her period is stuck inside, not coming out? Or it's because she's weak, or it's because she is not in the good hormone, or just pure stagnation? That's easy. You just watch here, the 内关大陵. First, you check the temperature in the 大陵 area. I don't know number. There's piece pericardium 7, and you check the veins here around the 内关 area. If it's dark and green, well, her period is dark and green and stuck inside. If it's red, usually we don't see a redness here. If it's a pale blue, that means her period is cold and also stuck in there. So you want to get rid of you want to make sure the period comes in on time or what? You can use the cold breaker. But make sure she's not pregnant, And hot breaker, the hot, this means the condition is hot, then we use this stuff to destroy the swollen condition. It's made of xuanzhen. Xuanzhen is the black shen, so it's cold and salty. It's good for clearing fire. Why do we use salty medicine, salty herbs for the fire, not the cold medicine? Why? Water? Water clear the fire, right? Yeah. And what's the next? 那个哪里去？ The cold breaker, okay. 那个夏枯草，不是 hot breaker， 那个哪里去？夏枯草 and 槐花. Actually, I designed this hot breaker to stop the stroke from happening. For high blood pressure, they have a lot of heat inside. Sometimes I'll tell the patient, hey, your body is like a volcano about to burst. So much heat, so much fire in there. You can check it easily by my the blood pressure system, which will be discussed a little later. But anyway, if the blood pressure is a little high, the heartbeat rate is high, definitely there's a fire. Or the blood pressure is very high or something, then prevent it from getting a stroke. And for lowering the blood pressure, we can use this heart breaker. It's very good.
So question,
yeah.
How do you know from the pulse only if the swelling of the blockage is cold, due to cold or heat, so we can determine if we use the cold breaker or tablet?
Yeah.
Do you guys know?
How do you
How do you know if it's a cold type of blockage or hot type of blockage? By the jump.
By the
right?
jump,
Right now
yeah.
we're talking about shape. So when you can determine the jump that couples with this pulse, so which one is the hot type of swelling? What's the jump like?
in Chang?
Very expanding and very pounding, very strong. That's the heat type of stagnation. And how about cold then?
It just a dead. Just be there, like this. Is it hard? Of course it's hard.
It's hard,
You
but
cannot destroy it. But it doesn't jump.
It doesn't jump very much. The
Just stay there.
amplitude is low.
That we call big stagnation, blockage. There's got to be something inside, but not with the expanding fire or inflammation or something. It's just being there. So we use something to destroy it. There's got to be some, should be some symptoms.
Jimmy,
Ah.
if the pulse shape is bean-like,
Mhm.
or a bit bigger, and if it's hard, don't you think it's more heat? If it was cold, wouldn't it be just
No, there's
thin?
different kind of heat. Thin is different kind of heat. I mean, different kind of coldness. This coldness means it's not moving. It's been there just like there's a rock in there for many years. It doesn't jump. It's still there. It's not cold.
So
It's blockage.
then you don't mind using warmer herbs?
Yeah,
for that?
a little bit. If his fingers and toes, all the circulation are showing you that it's cold, we use something like 四逆汤 to push all the system move better, like most 20% or 10%. All depends on your area. If your area is cold, 四逆汤 is very useful. I don't know about San Diego. Seems to be warm here. No, wintertime is cold, huh? 我在讲什么?
Her question is, if there's dryness, right, do you use the in tonics to moisten the lung? But Jimmy's strategy is no, because the dryness is caused by heat. So what he will do is he'll use heat-clearing herbs to take care of the dryness instead of using in tonic.
Yeah. And please remember, the short pause is not a sign. It's not two-dimensional. Not like this. Okay, this is a short or something, right? Actually, it's three-dimensional. It's round. It's solid. It's three-dimensional. So when you check the pulse, you move your fingers. You find, oh, there's something suspicious under it. You can move your finger like this to find out if it's dome shape or something like this. It's three-dimensional. It's not just a two-dimensional. It's three-dimensional. Just exactly like a being under the skin. Okay? If the bean pulse doesn't go away after treatment or after a long period of time, there's got to be something wrong. Okay, be careful, huh? Okay.